Hi, and welcome back to the channel. This is Jen, your Medicare and retirement guide, and we're back in the final installment of my series. My parent is aging and I have no idea what I'm doing, so I'm just gonna listen to this girl on YouTube and hopefully know what I'm gonna do when my parent turns 65. So I have a whole slew of videos in regards to this topic. This particular video is gonna be near and dear to my heart because I'm gonna use myself as an example of what happened when my parent turned 65. So if you like this kind of content, make sure to like, subscribe, comment down below on what you would like for me to cover next, and I'll be more than happy to do so. So other than that, let's get started. Today's topic is going to be caregiver and family support. So when your parent is aging, you will most likely be the primary alpha child or the caregiver for this parent. So these are the internet's most searched questions when it comes time to be your parent's caregiver. So the very first question, can I speak on behalf of my parent regarding Medicare issues? How do I get authorization? So this is something I wish someone told me when my parent became really ill after 65. So my parent, my mom specifically, did not have Medicare. She refused to sign up for Medicare because she didn't want to pay for that Part B premium every month. And that came to bite her in the butt in the end. And when it came time for me to speak on her behalf, I was always asked if I have power of attorney. That's the first one. And I needed her to give me written permission using the Medicare's authorization to disclose form. So those are the two things that you may need to go ahead and be aware of if your parent doesn't have you as power of attorney. This is a conversation that you're probably gonna have to sit down and discuss with your parent of what happens when they end up in the hospital or they're going to age into a chronic illness or terminal illness, and who is going to be there for them on their behalf, and what forms are you going to be signing in order for you to have authority to speak on their behalf and to go ahead and have access to their healthcare information. These are the things that you're going to need. You're going to need power of attorney and authorization to disclose forms. So those are the most important forms to have that conversation with your parent about. I did not have this conversation with my parent, and it was a pain in the butt because I could not have access to my mom's medical records when she was literally in a wheelchair and couldn't get to anywhere. And I had to constantly wheel her around because she was the only one who was able to get her own medical forms. And it was a real drag and a real stressor on my family. So don't let that happen to you. The second thing is, what paperwork or documents do I need to help manage their Medicare coverage? Okay, write this all down. You're gonna need their Medicare card, their A and B card. It's like a little red, white, and blue card. Have that. If they have Medi-Cal or Medicaid, get their state Medicaid card ready to go. Even if they're signed up to like a Medicare Advantage plan and or a Medicare supplement plan, those two cards, their red, white, and blue Medicare card and their state Medicaid card, those are for their lifetime. They need to have those two cards with them all the time. Make sure you have those two cards. Followed by it, if they have their Medicare supplement plan, carry that card and or their Medicare Advantage plan. The list of their medications, their list of their doctors are also extremely important. If you need to get into their Social Security Administration account online, make sure you have their login information and any other power of attorney documents that you have for yourself the moment that you get power of attorney over your parent. Make sure you have that ready to go. Carry it with you. Have like a little, wallet with all that information, or like a little file or folder. Have it on your phone. Have that information ready to go. I cannot stress enough how important having documentation is in this world where everything has to be written down and shown and proven. This is going to keep you at the top of your game with your parent to just get through the preliminary authorization paperwork. This is going to keep you on top so that you can go ahead and truly manage your parents' health, where it needs to be managed the most. Don't waste your time on all this preliminary stuff. Just have it ready to go. Next question. How do I help them avoid fraud or scams related to Medicare? So the big thing that I even tell my clients is the moment that I become their agent, I usually tell them, listen, you're going to be approached by everybody under the sun. You're going to have scammers as well as legitimate other agents that are going to approach you and tell you, I'm going to promise you this, that, in the world, use me as your agent. What I usually tell my clients is like, listen, it is your right to know all the information and all the benefits that are available to you because you are of Medicare age. What you can do is that you can politely ask them like, hey, give me the information that, is available. Let me look over that information. Give me as much education material as you can possibly get out of legitimate agents, not scammers. Scammers are going to just keep asking you for your information. But when you have a legitimate agent, trying to say like, this is what I can offer you, you can always grab that information and always talk to the agent that you signed up with, your most trusted agent, whether it be me or somebody else. Make sure you just bring that information back and show it to them. Say like, hey, I got offered this. Is this true? Am I missing out on these, benefits coverage? Were you ever gonna show me this stuff? Why wasn't I shown this information before? And have that person explain that to you. One of the things that I usually let them know is if you ever feel as if you are getting defrauded by someone, you can always call 1-800-Medicare. That is an official line by our government that is set up that if you feel like someone, frauded you, stole your information, they took your social, they took, whatever information and they just ran with it, then you can always call 1-800-Medicare and you can always report saying I was frauded. Do not use it against a legitimate agent who's just giving you free information. That is completely separate from somebody coming to steal your information. So make sure you know the difference between the two. The next question we have on here is, are there any local programs that help seniors with Medicare counseling or bill management? Yes, that is called the State Health Insurance Assistant programs. So that is a legitimate program set up by our government. It's usually called the SHIP program. They have an official website, shiphelp.org, and you can always go there to get additional information on top of, doing your own research, or when you come across somebody who gives you extra information in regards to a plan. That is always your right to go ahead and ask, and you should be able to have access to legitimate non-biased resources as well. And that is, like I said, the State Health Insurance Assistant programs. Say that 10 times fast. But for short, the shiphelp.org is always available to you if you want to learn more information. The final question we have here is, what are their rights if a service or treatment is denied by Medicare? Always know your rights. You can always file an appeal. When they send you a denial letter, they will always go ahead and have a form in that denial letter stating, if you feel that this was a mistake, you can always file an appeal, and you can always ask your advocate or agent to help you through the process because that is their fiduciary responsibility. I do that for my personal clients as well, that I will go ahead and make sure I help them file a grievance against, any doctors who have mismanaged their health. If they received a weird bill in the mail that is 100% should be covered by their insurance company, or they were denied coverage and I go ahead and help them file an appeal for it. That to me is part of my fiduciary responsibility for my clients. It's what they're entitled to, is what they worked for. And if you worked for your entire life to finally receive, healthcare coverage, then this healthcare coverage needs to work for you. So as an alpha child for your parent, these are the kind of things that your parent is entitled to. And it's the kind of things that I wish someone would have explained to me when I was going through this with my mom. I was very, very fortunate that I landed at a safety net hospital with social workers who worked tirelessly to go ahead and get my mom connected to a lot of socialized programs and benefit programs to help us through the time that she was around and try to make things much easier on me and my family. And I'm indebted to those social workers. They really, really do hold up their responsibility of their job. And anytime that you have access to free help or folks like that in the field that take their jobs to their next level, give them a listen. They're there to help you. That is their responsibility. And as always, you need to make sure you ask the right questions so that you get the most out of your healthcare benefits. Other than that, those were the internet's most searched questions in terms of caregiving and family support. Remember, if you like these type of videos, share, like, subscribe, and comment down below on what you would like for me to cover next. And remember, as always, to contact me and for me to review your benefits. My link is in the description down below. Other than that, I will see you in the next video. So take care of yourselves. Bye-bye.